Welcome to Public Health Matters, where we talk about matters of public health. I'm Bobbie Bagley, Chief Public Health Official and Director for the City of Nashua's Division of Public Health Community Services. And I'm here today with Marie Ramos, who is a physician, family practice medical doctor here in Nashua. And we are just going to talk about all things related to all the wonderful things Dr. Ramos is doing in her work. And she has some great news for us in New Hampshire, as she is now the first African-American president for the Medical Society. And so let's talk about that. So Dr. Ramos, tell us about yourself, your practice. And you've been here for a while, because I've known you, I think, when you were at Lamprey, and you may have just come back to New Hampshire to practice because you wanted to practice in the community. So let's talk about that. What is it like to be a physician practicing at that community level? And then you were doing so many other things in that time period, nationally, speaking at conferences, being a part of national associations. So we're going to learn a little bit more about our Dr. Ramos, who's here in Nashua. She's actually in our region, the greater Nashua region. And so let's just talk. So tell us all about yourself, and what do you want the Nashua viewers to know about Dr. Ramos?
Well, thank you so much for inviting me here. I think the last time I was here was around COVID.
It was.
It was around COVID, so it's been a while. Yes, so I am a first-generation Haitian American, and born in Boston and raised in Manchester, and went to medical school. I'm the first doctor in my family. Went to medical school to be a family physician, and I didn't know what family medicine was.
Yeah.
I just knew that I wanted to take care of what I thought was the foundation of communities, which was family. I wanted to be able to take care of the kids, deliver the babies, do mission work if I wanted to, and not leave a stone unturned for people. So that's something that's always been part of me. What got me interested in public health, I don't know if you know this, Bobbie, I was the first youth spokesperson for the then New Hampshire Lung Association.
Really?
Yes, when I was, I think I was like 13 or 14 years old.
Really?
And that's where I was able to share for the first time the then Governor Jean Shaheen, share my story as an asthmatic and how tobacco affected me as an asthmatic. And that was really, really pivotal in my life, seeing that people listened to me even though I was a child. And we got taxes on tobacco after that. That was a really great time.
Look at you advocating as a teen.
Yeah.
And in the field of public health.
There you go. And that was the first time that I really understood that individuals, our stories matter. And I also realized that I'm really good at telling people's stories. And as a doctor, that's what I do all day long. So I'm a National Health Service Corps scholar. Basically, I was able to get a scholarship through HRSA, through the government, to practice in underserved areas. And I like to tell people I practice Dr. Quinn medicine.
Nice.
So I delivered babies, I did C-sections, I worked in the hospital, did hospice care, lots of procedures, and I lived in a small town in the mountains of California, population of 3,000.
Wow.
And I was one of 3 family doctors that took care of the whole region before I came back here in 2016.
Wow. So that is, I did not know about the asthma. And we had the whole asthma coalition, the program. And I think they ended up calling it New Hampshire Breathe or Breathe New Hampshire.
That's right.
So before it became Breathe New Hampshire, you were the spokesperson.
That's right.
That is amazing.
Yeah.
Wow. And got a chance to dibble and dabble in public health, and you probably didn't even know what public health was at that time.
All I knew is I wanted my mom and dad to stop smoking. And I figured if I was on the TV, they couldn't say no to that. And they actually did stop smoking. So
out of the mouth of babes, though, right?
That's right.
And so there must have been something, innate and intuitive in your thinking, even at that age, where you cared about your own health, but you cared about theirs as well. Because your desire for them to stop smoking because of the impact that it was having on you led you to want to do something, and then not just be a spokesperson for asthma and smoking, but then to also go into medicine?
That's right. You know, I think what I have realized about my walk and my journey professionally is that ever since I was little, and this might be from my cultural background, community is so important. And recognizing that every voice matters and everyone deserves the right to be the best forms of themselves. And that's something that I carried with me ever since I was little. Now, the two most impactful people in my life were my teachers and my doctors, because I was really sick. And I realized that I love to teach. I love telling stories, and I'm fascinated. I'm absolutely fascinated by how resilient people are, even at a young age. And that's really what sparked my interest into being a doctor. I said, I want to be impactful, just like my doctors were impactful for me. And I want to be an example to other people that their stories matter. That's
awesome. And you know the reason why that's awesome is because it sounds like during your journey and in your experience with your health condition, chronic health condition, you were able to build a nice relationship with your providers. So let's talk a little bit about how important that is as well. So you grew up in Massachusetts. And having the encounters with the clinicians, how important was that for you? Because when we have negative encounters, there's a different type of experience that people have. That experience will delay care for them, and that could be detrimental as well. And so you must have had providers that knew the importance of establishing a relationship with their patients, even with you as a young person.
Yes, absolutely, Bobbie. So I moved to New Hampshire when I was 10. And
so you grew up in New Hampshire. You're born in Mass, but
I am a Granite Stater.
Okay.
I am a Granite. I claim New Hampshire.
You got to tell us then about that health experience, those health experiences, because the reason why I was thinking Mass, because they have more diversity in Massachusetts, so clinicians are used to seeing diverse clients, and so that may be why that experience was. We actually do a lot of work around people of color not having such positive experiences with healthcare providers, and so then there's a lack of trust. So for years we were assessing that, having conversations about that, doing these intentional social interactions with people of color in the community to learn about their experiences so we could help them, help us provide information to our providers about the importance of the relationships so that that trust would be there. So you grew up in New Hampshire and you had those kinds of trusting relationships with your providers that then led you to, you said, your doctors and your teachers, which you had a very unique experience here in New Hampshire compared to some of the stories that I hear from others.
I really did, yeah. And you know, one of the things, because I am a first generation, I had to go to doctor's appointments with my grandma, and I had to interpret. We did not have the opportunities that we have now in New Hampshire for interpreters.
Right.
And so if you could imagine a 10-year-old explaining things like breast cancer and mammograms and blood pressure control
which are now
to
very
the grandmother. Right, exactly. And so, but that is not an uncommon experience, unfortunately. So that was one thing I realized, is that, you know, language and being able to translate people's experiences matters so much. And having curiosity and not just expecting certain things because of our biases is really important. So my family is we come from a very educated background in Haiti. My grandmother was a teacher, so I had to speak French. When I was with her, I could not speak Creole, which is another language in the country. And what was interesting is, even when I was young, I could see how differently people treated my grandparents for their accents, or, you know, thinking that they didn't understand or couldn't understand. So that was something that was interesting. Now, I did have positive experiences, though.
Which is great.
Yeah, I think that's really important. And when I was young, especially as a youth spokesperson, I was doing this was the big thing. I was on MTV doing a smoke-free commercial, and that was sort of like an entree. And I remember someone telling me that, you know, you'd make a really good doctor. You'd make a really good doctor. And I never
so that
thought
seed
about
got
it.
planted.
It really did.
Yeah,
So
yeah.
you never know the impact that you have,
yeah.
especially as a clinician. So, you know, especially nowadays with, unfortunately, not having really great sources of evidence-based, trustworthy information, it's even that much more important to make sure that we have an established relationship with clinicians, with a primary care physician or clinician, and certainly our public health department.
Right. And I'm glad that you include us, because a lot of times public health is not even in the same venue, and it's so important, right? Because when we have the encounters with our clinicians or, you know, our practitioners, they are, unless we have a chronic condition, they're very sporadic, right? Maybe once a year. But public health are the ones that get to interact with the community on a regular basis. That's right. And that may be why you're also interested in community practice.
There you go.
Yeah.
So I knew I wanted to take care of communities from the get-go.
Yeah.
And the National Health Service Corps is a loan repayment program for clinicians that want to serve in underserved areas. And so that afforded me not only the opportunity to take care of folks in both rural and urban spaces, but that gave me a really keen understanding that at the end of the day, need is agnostic of where we live.
Right.
The need in more urban spaces like Nashua or Manchester can feel the same as places even in Berlin, right, and in Coas County. Poverty is agnostic.
Right.
So it's really important that we look in a global sense.
Yeah.
Yeah.
And approach it that way. So that's the approach that public health takes, right? So we operate in a system that includes, you know, our primary care practitioners, medical, dental, legal, police, fire, teachers, schools, faith-based organizations. And so that group, which is very heterogeneously made up of specialty areas of practice and all levels of disciplines and coming from all kinds of domains, that makes up the public health system. So everyone's a part of it. And it's really interesting that you mentioned people having to now look for information that's coming from a reliable source, right? And so I don't know if you heard it, Dr. Ramos, but I did yesterday. I was at a conference, and someone came and said, "Oh, did you hear about what the CDC is now saying?" And so, and I had to read up on it. I said, I've got to look this up. I said, there is no way that our Center for Disease Control and Prevention, which is who we rely on, right, for the science, who we rely on for evidence-based information for decades. And now, I think because things have become so politicized, we've got that body, that organization, that bureau now speaking and saying things that evidence for decades has not supported.
That's right.
That vaccines cause autism. And so you're probably going to hear a lot from patients, probably even other practitioners. And how do we, because in public health, it blew my mind. I'm flabbergasted.
Absolutely.
How do we counter that type of that's not even misinformation, misinformation and how do we counter that when we know vaccines have saved so many lives, continue to save lives, and it's been proven for decades that vaccines do not cause autism. Now, there may be other things in our environment, right?
Right.
So why don't we focus on those things? So how do you counter that as a physician?
Yeah, you know, I served recently, just ended my tenure as the chairperson for the Public Health Commission to the American Academy of Family Physicians. And so one of the bigger things that we had to address was all of this disinformation and how could we create trusted resources now that, unfortunately, the foundation and the breadbasket is essentially of our public health, it has been completely dismantled.
Yeah.
And so I'm really proud of the fact that organizations like the American Academy of Family Physicians, American Medical Association, pediatrics, OBGYNs, we all came together and created a coalition so that, particularly for vaccine safety and immunization safety, there's a trusted resource for everyone. So I think that's one thing to acknowledge too. Not everything that we see, and this is something I tell my patients who still contact me online, you know, not everything that you see online is real.
Right.
And it's important that you have your trusted sources of information. And I'm grateful that even with all of this disinformation, still the public sees their clinicians as the best source of information and trusted source. And so it's that much more important that we're able to work with our public health department. New Hampshire, we have a state health assessment improvement plan commission as well to help connect all of these areas where we live, work, eat, and play so that we can have the same kind of information that is trustworthy. So it's something that I put on social media often. Again, a place where I am able and afforded the opportunity to share real experiences of my patients, having lived during, you know, times when we did not have really great vaccines or in places that don't have great vaccines and what happens. But certainly, you know, autism is not caused by vaccinations. Tylenol is safe in pregnancy. These are things that have always been true. And it's important when I tell my patients, when you feel scared, it's important to stop and reflect on why you're feeling scared. Is it because of the unknown? And if it is because of the unknown, then you've got your favorite family doctor here that you can ask for. So it is an interesting time, to say the least.
It is. And so you would recommend when people hear these different messaging that they make sure they connect with their practitioner to get what the real information is.
It's really important. And if you don't know, the public health department here in the state, so great, so much information and a wealth of knowledge. Your listeners can follow me on Instagram if they want trusted sources. So that's DRM Ramos with the A if they want to get trusted information. But there are so many ways that you can access now, whether it's TikTok or what have you. Look and find AAFP. Look and find your New Hampshire Medical Society. We have webinars all the time. And if you still are scared, that's okay. It's okay to be scared. This is uncharted territory as a country.
It is, and it will be for a few more years. And so I think the best thing that we can do as advocates for our community, advocates for patients and clients, even for our own families, is help them understand that there are places where they can still get trusted information. And that's what we do at the Public Health Department, right? And so we have a newsletter, and we do put the information in. In fact, every week we cover what those main issues are. And if information that comes out is not correct, we will push out the correct information. And I'm glad that you did offer the opportunity for folks to contact you, because I think that's important for them to hear from trusted healthcare workers as well, in particular our doctors and our clinicians. And so that's really important. Tell us a little bit about the role that you have now as the president of the New Hampshire Medical Society. What does that mean? And did you all have to have an emergency meeting after that news went out on Wednesday?
Yeah, man, it is unreal. And it's really coming back full circle for me that a little girl, 10 years old, translating for her grandmother at the doctor's office, is now representing over 2,000 physicians in the state of New Hampshire. I was really just moved when I accepted the presidency just a couple weeks ago, Bobbie. In the 234 years of the Medical Society's history in New Hampshire, the first medical society in the country, we got to induct a president.
Yeah, we got to change history and create more history.
That's right. And one of the things that I had mentioned to my colleagues in my address to them is that now more than ever, we need to come back to the basics. And the whole reason we became physicians in the first place was because we wanted to help and heal our patients.
Right.
And in a place now where we don't have as many safety nets that are trusted, the clinician, patient, public health triad is so important. We have to be aligned in purpose.
Right.
We need to be anchored in our principles as being healthy and focusing on well-being. And we need to pursue that together. If we don't, then we're going to face a lot of challenges, and it's going to be that much harder. So yeah, the Medical Society, really excited next year. In the new year, we'll have more opportunities, not only for our patients to get information, but also for our physician colleagues and clinician colleagues around the state to find community together again. It's been really hard since COVID. And I lost a lot of friends since then, either being burnt out or, unfortunately succumbing to different illnesses.
Yeah.
And so it's really important that we come back to community, come back to our purpose, which is to be the best forms of ourselves together.
Yeah, and do that with integrity and intentionality around the service, right? So as these people that are in these spaces, to help take care of the health and well-being of individuals, families, communities, doing that with some integrity, that looks out for the best interest of the community as a whole. Because we are also a part of this community, right? And so when we put messaging out, that will then create, and I was talking with someone yesterday and I said, if we get people who then follow this rhetoric and they stop vaccinating their children over the next few years, then we're going to have that pool of adults over the next 30 years if everyone survives. Because, vaccines were the number one, immunizations and vaccinations have been the number one public health intervention that has saved so many lives, in particular, the lives of children.
That's right.
And so what is being done right now is going to undo so much of that effort and that work in health and well-being that we're going to have 10 years now that we have to fix that. If not 30.
Absolutely. One of the most difficult things for me when I was in training was seeing a child succumb to pertussis, which is whooping cough, and I couldn't help them. A baby dying from RSV. Adults succumbing to tetanus, measles. These were things that were commonplace, and people died, or they were significantly hurt within their lives. And so it was so difficult for me to have to hold a baby and tell their mom that I can't do anything for them. So it's one of those things that we don't know what we don't know.
Right.
And I hope that our patients, the listeners, can remember that if anything, they should not be struck of the right to choose what's best for them.
Correct.
And so we need to do that in an evidence-based way so that our patients can be informed, and we need to have those services available. Stripping people from the right to do things that is good for them is not the American way.
Right.
And medicine should never be political. Health and well-being is apolitical. This is a non-political issue.
Right.
So I do think it's important that now more than ever, our listeners need to call their state legislators to make sure that they are telling their stories. And the New Hampshire Medical Society is going to help them do that.
Nice.
Yeah.
Nice. So I know that we probably have just a few more minutes. We have to talk about the exchange. We have to talk about health insurance. We have to talk about Medicaid expansion, the market. and some of those changes and the impacts that it can have on individuals, including now the workforce requirement for those who receive Medicaid. And there are individuals who may desire to work but can't work. And I know they're going to have some waivers in place for some, but people are going to have to come up with some rationale for if they can't work, why they can't work, and be able to prove that, or they're going to lose their health insurance. Talk a little bit about that impact in the next couple of minutes.
Yeah, it's so vast. Tens of thousands of Granite Staters are not going to have insurance at the end of this year. Tens of thousands. And one of the things when we had Medicaid expansion particularly is that the folks that benefited from Medicaid expansion were kids, and then also working individuals.
Right. Yeah.
Folks that owned their own businesses
Right.
that couldn't afford health insurance until then. So we have to remember that maybe the pictures of who is being affected in our minds is not really the true reality.
Right, right.
Premiums are going to go higher, sometimes up to $200 a month. And as physicians, the reimbursements are going lower. And so we're doing the work.
Right.
We're going to be there. But it is a time of strife. And so it's that much more important to make sure you have a well-connected community and resources. I'd love to come back so we can have a deeper conversation about this.
We are definitely going to have you back because there's so much that we can talk about. And I do thank you so much, Dr. Ramos, for being here with us today. And I am looking forward to, and maybe we can do a monthly, because I think it is something that over the next few months, we're going to need to have clarity, integrity, and we're going to need to have good information shared with our viewers. So I'm looking forward to having you back.
Thank you so much.
I'm Bobbie Bagley, and I'm reminding you today to have a great day and a better day tomorrow. I look forward to seeing you next time on Public Health Matters.